Hi everyone, and welcome to this video that we will be doing on low intensity interventions and a little bit more about how we work in the low intensity team. So to get started, I'll introduce myself properly. And my name is Veronica and I'm a trainee psychological wellbeing practitioner here with the service.
And my name is Shauna. I am a qualified psychological wellbeing practitioner with the service.
Thank you. And now a little bit more about the Richmond Wellbeing Service. So at the Richmond Wellbeing Service, we work with common mental health difficulties. And in the LI team, there are several that we work with, and that specifically being anxiety, low mood, panic, and phobias. So Shauna is going to tell us a little bit more now about what that treatment specifically looks like.
Yeah, so Veronica just mentioned the LI team, which is the low intensity team, which is what we offer as we are psychological wellbeing practitioners or PWPs. So we are trained to offer short cognitive behavioral therapy interventions, so low intensity CBT interventions, which follow the principle of guided self-help. And this really aims at guiding you to become your own therapist. So we give you the tools and techniques, we help you put them in place, and outside of the sessions is really where you put that in place and you get your treatment from. So those sessions are 6 weeks, which is why they're brief, they're quite short term, and the sessions themselves tend to be quite brief as well. We do mainly offer group treatment in our service. So this is groups of people experiencing the same mental health difficulty. And then we also offer an online program where you do your treatment on the program and we help to guide you through that every couple of weeks.
That's perfect. Thanks, Shauna. A question that I commonly get from patients that I work with is that they really have this image in their head of therapy being a one-on-one space where you can share with the therapist. And a lot of people wonder, is there a scope to do that instead of the group or the online treatment?
Yeah, and I think that's right. That is a very common question we get asked. We don't tend to offer individual work as a first line treatment, and there's a couple of reasons for that. We have groups in our service, as I mentioned, and online support. The reason we do that is the online is quite flexible. It works around people's schedules quite well. The group-based treatment is really nice and supportive. There's other people who are experiencing the same mental health difficulty, and often what we find is having that extra support can be really helpful. But I think what's most important is to recognize that the evidence base is the same. So receiving group-based treatment or receiving online CBT has the same evidence for individual treatment, and that is why we offer more the group side of things. It helps us also to keep our wait list down, which means that you get treatment a lot quicker. It is something we can discuss with you on a case-by-case basis, however, so if you are having any concerns about that, do just let us know at your assessment.
That's fantastic. Thanks for answering that question. So the next thing I'll talk a little bit about is the stepped care model, and this is just so that we place the LI intervention within the wider service model. So really the stepped care model just means that we work on the principle of offering the lowest dose of treatment first and increasing that as necessary. So this is very much the same as the medical model. So if you were to go to your GP with hay fever, for example, they would give you the lowest dose of tablets, and if that didn't work, then they would gradually increase the dose until they found the right dosage for you. And this is very much what we do as well in mental health. Now, there are 3 steps that we go through with this, and I have a little picture of this I'll try to show you. So here are the 3 steps that we use in mental health. Step 1 is right here at the bottom, and this would really be recognizing the mental health difficulty. So perhaps going to your GP or making a referral to us online. Then step 2 is the low intensity treatment. So this treatment that you would be getting with us. And Shauna has explained that this works on a guided self-help basis. So the focus is really on getting you to be your own therapist. And this is why the sessions are so short. So the benefit really comes not just from attending the sessions, but really what you're putting into place in your day-to-day life outside of that as well. Now, this is all done by the principles of cognitive behavioral therapy. And we have another video on that if you wanted to learn more about that. Now, at the end of your step 2 intervention, we would have a review of how you found the treatment, whether you feel like it's the end of your recovery journey or you feel that you need more support. And if you do feel that more support is necessary, we do offer a step 3 within the Richmond Wellbeing Service. Now, step 3 is a little bit different from step 2, and the way that it differs is that the interventions are a little bit longer. They run for several more weeks. and they're run by a qualified CBT therapist. So it's a little bit more involved there as well.
Great. I think one of the questions that we often see is people feeling like their mental health problem is quite serious, it's quite severe, and wondering whether they can go straight to a high intensity treatment rather than going through low intensity first.
Sure, and I hear that concern kind of when you are experiencing mental health difficulties, that can feel very distressing, and you may feel like you want the highest dose of treatment first. And what I will say is there are some conditions and mental health difficulties that would go straight into step 3. So in low intensity, we don't work, for example, with PTSD, OCD, and blood and needle phobia, amongst some other conditions. And if this is what you were experiencing, you would receive treatment at step 3 straight away. However, for other more common mental health difficulties like anxiety, low mood, panic, and phobias, the evidence does show that by doing the step 2 treatment first, you actually will get more benefit out of the step 3 treatment should you use it. And this is because that really teaches you kind of the foundation of CBT, the basis of it. It gives you some techniques to practice so that you're really, really getting the full benefit of that step 3 treatment when you do start it. So our recommendation and service model really is to work your way through the step care model for the best outcome as well.
Great. Thank you for explaining that.
Perfect. So that really is our explanation of how treatment works at low intensity. If you have any other questions about that, do speak to the PWP who conducted your assessment. And if you do want to learn more about our service as well, please watch our other videos on CBT and the specific treatments that we offer. But thank you for watching.